Welcome to the SCR Connection. Thank you everyone for joining us. It's my pleasure to introduce our guest speaker, the CEO and founder of Black Girl Health Foundation, Ms. Porcha Johnson. Black Girl Health Foundation is a nonprofit 501c3 that creates pathways to improve health disparities and health literacy of Black women and girls through education, engagement, and empowerment. Before Black Girl Health, Portia was a TV news reporter and anchor for 13 years. This experience led her to becoming a health advocate that will reach millions of individuals through Black Girl Health digital campaign and helping thousands of women. Portia serves on the NNLM HIV AIDS Coordination Center Advisory Board. In today's SCR Connection, Portia will tell us about her national campaign, Pop the Question. Thank you, Portia, for being our guest speaker this morning, and I will turn everything over to you.
Well, thank you so much, Edward. I so appreciate it. Thank you, Edward. Thank you, Brian. I appreciate the whole National Network of Library and Medicine staff for inviting me to do this presentation. And thank you all for joining and participating in this webinar. So that was a lovely introduction. Just to give you some more background about me and Black Girl Health. I founded Black Girl Health in 2014, which is our LLC. I founded the foundation in 2019. The foundation serves as a mechanism. The nonprofit foundation serves as a mechanism to increase outreach to target women of color on all sorts of health issues that disproportionately affect them. So one of the big ones, obviously, is HIV and AIDS awareness, but we certainly work on issues that pertain to other health issues that pertain to diabetes, lupus, heart disease, obesity, you name it. So we focus most of our outreach efforts online because that's where our demographic is. So we do a lot of social media campaigns that have very strategic call to actions to get them to change their behavior or increase their knowledge about a particular disease or whatever our mission is for that particular campaign. In addition, we do a lot of outreach workshops, in person and virtual digital workshops. To reach the target audience, and we do this all across the country with different cities. We have worked with NLM, the National Library of Medicine, for the last about 4 years, particularly doing our Pop the Question campaign. So the Pop the Question campaign initially started as something local and regional to the Pennsylvania area, and then it expanded to a more national campaign where we targeted communities all throughout the country and in different cities, including Louisiana and Texas, states that you guys cover in the SCR division. So I'm going to kind of talk to you guys about what the Pop the Question HIV awareness campaign really is, and how we target women of color. So the first screen that you see here, the cover screen, hopefully everyone sees it. And please feel free in the chat box if you're not seeing the screens, just let us know. But Pop the Question, you can see the summary here. This is a campaign that encourages women of color to take control of their sexual health and be the ones to pop the question to their partner to get tested. So we all know Pop the Question, usually you think of someone getting down on their knee and popping the question to their significant other to get married. So we did a play on words. And this is, the woman, the partner asking that individual to get tested before they, continue with any sexual relations with that person. We wanted something very catchy to get our audience's attention. And we felt, through our experience, that's very important. It's to engage them first and then give them education. Because if you just start with education, people just spaz out. They're not, they're like, not really interested. So we use catchy titles, one of the big things, and you'll see a lot of other things that we use, but we use catchy titles to grab people. Um, so to continue on with the method behind Pop the Question, it's a strategy that encourages national conversation amongst women of color around the best prevention methods for a healthy lifestyle. So this strategy we talk about in this whole campaign of Pop the Question, we find a interactive and engaging way to talk about PrEP, what PrEP is, what PEP is, and how do you integrate those practices into your daily life. So you will see in the next slides how we get creative to educate the target audience, which is women of color. Now, our Pop the Question campaign, through this social media campaign, we use a lot of social videos to engage the population. With this webinar, with the system that we're using, you won't be able to see the videos. I won't be able to play the videos, but I know Brian and Edward, SCR, is putting the links in the chat box, and you will also be able to if you're interested and you want to see the videos, you can just email me and I'll have that contact information at the end, and I can send you the videos as well. I'll send you the entire PowerPoint where you can actually click on the videos as you view the PowerPoint. But for today's purposes, you won't actually see the videos. So I'm going to go to the next slide here. So everyone should be seeing the slide. It says, to the sisters that want to pop the question but don't know how. So that is the slide that you should be looking at right now. If you cannot see it, please, send a message in the chat box, and we'll try to get that corrected. But this is the slide that everyone should be seeing. So this is with the Pop the Question campaign. We actually we give women of color ideas and help and support to pop the question to their significant other. It's not easy to pop the question. So just saying, like, have you been tested? It's not always easy. Having conversations about sexual health, HIV and AIDS and stuff like that, that's not an easy conversation. A lot of times, especially the African American population, I can say, being an African American woman, I've experienced that sometimes, guys kind of shy away from that conversation. People in general shy away. They don't really want to talk about it, but we need to talk about it. Pop the Question makes it catchy and easier to have those conversations in kind of like a fun kind of way. And it just makes it more comfortable. So with that said, we give people tips on how to make it easy to pop the question. So one is, make it a shared experience. You see, that's number one. So a shared experience is, let's both get tested. Have you been tested? Won't we both do it? So it's not one person doing it alone or feel like isolated that, oh, you need to get tested and I don't. But it's like, hey, let's both get tested. That makes it easier, to protect your sexual health. Number two is being tested already. So, I mean, going to your partner and saying, have you been tested? Well, if you've already been tested, that probably makes it a little bit easier to have those sexual health conversations. Like, oh, I went to go get tested the other day. Have you been tested already? So that partner knows that you've already been tested. The next point is, present your partner with knowledge. So talk about the HIV and AIDS and sexual health, and how, especially African Americans are at a higher risk. State the facts about, why it's important to protect yourself. A lot of people are not knowledgeable about, protecting yourself, or just HIV. A lot of people think still HIV is a death sentence as well. People are not, all familiar about PEP and PrEP. I know there's been a lot of promotion of PEP and PrEP, like on, on TV and different commercials and stuff. But still to this day, when I have conversations with people, they don't know about PEP and PrEP. Having those conversations and showing, you're knowledgeable about, sexual health and protecting yourself is important. The other thing, actually, we already mentioned shared experience. So it's 3. So that's 3. That's actually a typo. So yes, so those are the 3 points on how we help women to pop the question and have those conversations with their significant other. The next slide everyone should be seeing, and I want to make sure, I'm just going to go to the chat box to make sure that everyone can see the screens okay. Okay. Oh wait, okay, I guess we have some questions and stuff. I'm going to get to those questions in, I guess, later after we finish the presentation, and then I'll get to people's questions and comments. So how to pop the question became a national social media campaign. So the way pop the question, and if you can see right here, you see this play sign where you can play that video. So you guys, again, can actually play these videos. Again, SCR, Brian or Edward, I guess are going to send you the links, but I will also, if you email me after this presentation, I will send you this PowerPoint, and in the PowerPoint, when I send it to you in email, you can actually play it through the PowerPoint. I just can't do it in this system, but you're able to play the videos. There's several videos in this PowerPoint, but you can play them. They're very comedic and funny. So I encourage everyone to play the Pop the Question videos. But okay, so how Pop the Question became a national social media campaign. So our whole method is, as I mentioned before, engaging people first, and then giving them education. So we use social media influencers, from national influencers to influencers that are kind of mediocre, meaning don't have as much followings, but have a lot of followings, but they're in that like 10 to 20,000 range of followers. The national social influencers have like 100,000 and up, and then we use the social influencers that are in like the 10 to 20,000 range, and then we'll use some smaller influencers that have maybe like a couple of thousand or something like that. But they're all influencers. That is huge. Because they already have a following, they already have people that love them, love the things that they post. So we use them to help us promote our Pop the Question campaign, get it out there to the masses, to the target market that we're trying to reach. So Black Girl Health has plenty of different social influencers that we work with. This first video is a national social influencer that has about anywhere between 500,000 and 1 million followers. She's actually out of Hollywood, and she did a very comedic kind of a script video on protecting yourself and and popping the question to your partner to get tested. That video helped reach millions of views. What that did is that brought, after people watched that video on social media, you see those arrows there, that we had a call to action for them to go to our Pop the Question website that we made, blackgirlhealth.com/awareness, to learn how to pop the question. And those were the three statements that I showed you on, like, just different tips on how to pop the question. When they landed on our page, they were instructed to complete a survey. That survey was to help, it's an assessment, if you will, to help increase their knowledge of HIV using NLM resources. So that's where we, that's where we started to kind of, try to throw and increase their knowledge of HIV. So that's how the method goes. Engaging them with something, captivating, giving them a very clear call to action after that video to land on our page, where we're giving them all this clever stuff on how to pop the question, and instructing them to fill out this assessment to really increase their knowledge about HIV, so they can feel empowered when it comes to popping the question, because they know about their sexual health. They know what it means to protect themselves. So that's the method that we take throughout the Pop the Question social media campaign. So I'm going to go to the next slide. In addition to helping to make this a national campaign, the steps that we took through the years was collaborating with beauty queens. So you see the title, How to Pop the Question Like a Beauty Queen. So you remember before I talked about social influencers, and there's, like, you got your large scale social influencers on the national level. You got kind of the more mediocre that don't have the same amount of followings as your national social influencer, but they have about 10 to 20,000 or so. And then you have more smaller social influencers that have like 1,000, 2,000, 3,000. And a lot of your beauty queens have that. They have a couple of thousand followers. And so we partnered with beauty queens in each state that we wanted to target. Most of these states have a high concentration of HIV, cases, and they're the ones that helped us to promote Pop the Question and their communities. So that was another tactic that we use for Pop the Question to be on a more national scale. And again, with this approach, each of these beauty queens did a social video. And if, again, you'll be able to see this video, you see where it says press play, you'll be able to see this video when I send you the slide. If you want to see more or whatever, I can email you the slide, and you can look at this video. But this is a video that plays on social media, and the same process that I mentioned before, engaging them with an engaging video on social media, because that's where people are, that's where they're getting that's their first interaction with knowledge is on social media. Their first interaction with knowledge. You grab people right there. That's where people are. And when you have them at hello, then you can guide them into learning more about whatever it is you're trying to do, or whatever it is your mission or whatnot. So we have them at hello with the video, and the same process. Then we get them to the Pop the Question page. They're learning about how to pop the question. They take our call to action, and that is that needs assessment to increase their knowledge of HIV awareness using NLM resources. So we're going to go to the next slide. Okay, so the next slide, blackgirlhealth.com awareness. So how this slide tells you the process in which we use to help increase knowledge of PEP and PrEP on our page. So as I mentioned before, blackgirlhealth.com/awareness, that is our Pop the Question page. That is the page where we have integrated NLM resources into that page, whether it be the survey, different links that lead to like AIDS info and AIDS source, different links that we connect the viewer with to learn more about HIV or PEP and PrEP. We also have on that page a PrEP locator map. So if people want to find a provider or whatnot, they can find that on that page. In addition to that, we increase knowledge of PrEP and PEP by the same thing of using the social influencers to do videos. We have also in some of the videos, which you can kind of see these screenshots here, I'm going to explain it. We have included in the videos an interactive questionnaire form. And how it works is as they're watching the video, it will stop at points and ask the viewer it'll say like, oh, what should so-and-so do? They have just had a sexual encounter and she's not sure if she used a condom or not. What should she do? And then it'll be like a question and answer for that person, and it allows them to say, that maybe that person will say, okay, that person should, I don't know, use PEP, right? Or get PEP. And then it'll say, you answered correctly. And it'll say, PEP is this and that and that. You should use it within 72 hours of possible exposure. So that's that is how we increase knowledge of PrEP and PEP. We made the social videos interactive with questions that stop in the middle as you go through the video and ask the viewer, what should that person do next? Or this is what that person can do. And it kind of gives the viewer a multiple choice to answer the question correctly, hopefully. If not, it tells the person what the correct answer is, throughout the course of watching the video. And also in the video, we also promote AIDS info. We specifically say, please visit, AIDS info for more information about PEP and PrEP. So they know where the information is coming from. I think that's very important that people know that all this information is coming from a reliable source. So our source is NLM. For everything dealing with, HIV, we always, say that, the National Library of Medicine is our source. We want people to know that this isn't just us coming up with this information. This is coming from a reliable source. And again, you can watch the video and go through the interactive video and see how it works. If you want to email me and I can send you this whole PowerPoint and you can go through it. Or actually you can go to blackgirlhealth.com/awareness. You can, and this video, the interactive video is right there on that page. So you can just go there and you can do the interactive video yourself and you can see how it works if you go to blackgirlhealth.com/awareness. I'm going to go to the next slide. So pop the question, social media campaign evaluation metrics. So hopefully I'm not going too fast, folks, and everyone. I hope everyone is comprehending everything. Hopefully everyone is understanding kind of the process that we use. So in the end, social media campaign, I just kind of give a summary of, our metrics over the last 4 years. We have reached, thank you, Marilyn. I'm so glad that you got it. Molly, thank you so much. Yes, so we have reached actually over 6 million people. We've gotten over 6 million impressions. We have gotten, it's actually a little bit more than 400 surveys, but yes, to say the least, 400 people have completed our surveys. And we have done 5 social videos with our national influencer. So we've done way more than that with other influencers like the beauty queens, but with national influencers, which makes up the bulk of our millions and millions of views, have been from our national influencers, and we have done 5 of those videos throughout the years. So, um, so just to kind of sum this up, and I have some takeaways from you for you guys. Um, so spreading HIV awareness using social media campaigns. My takeaways for you guys is one, identify your target audience. You can't be everything to everybody. And you can't use a campaign for one particular population and think that it's going to engage all populations. I always take the method of keep the main thing the main thing. So focus on one thing, focus on one target audience, and be really good at knowing that target audience, knowing what they like, knowing how they engage, and doing your best efforts to really captivate that audience. So that's what I'm a big proponent of. The other thing is identify impactful partnerships. Um, for us, it's, we use a lot of, again, beauty queens, social influencers, people who are, really known in the community, and in the African American community, and really respected, to help further our campaigns. Now, Black Girl Health, through the years, we're at a point where a lot of people, I mean, obviously, they come to us. And we partner with a lot of people because we have a pretty large, population that, that follows us. And we've developed a brand in doing all sorts of social media campaigns and workshops through, different cities. So yeah, I would recommend that, try to partner with, organization that can help move your campaign along. So it could be Black Girl Health for you guys if that's something that you guys are interested in. Develop a brand that is catchy and can last. So as I stated before, pop the question. That was catchy, and we thought that could last, like it's not a one-time thing. So we're not just doing this one year. This is something that we thought could or would coincide with our brand, be a part of Black Girl Health, and be something that is something that we do every year. And I think that's important to look at when, I guess for, people who are, just in general, for recipients of different awards and funding, when they're proposing projects and different things, at least it's a method that we take. If we're going to propose something, then it's something that we feel that aligns with our brand, that we can, that it's not just a one-time thing, it's something that will be a part of our brand for years to come. And that's how you develop a following as well. And that's how you get better at your project, and it grows. So, and last thing, again, what I've said time and time again throughout the course of this presentation is engage and then educate. It's not the other way around. Don't educate and then try to engage, or just educate. Engage them and then educate. That is for, and this is specifically, again, our target audience is African Americans, so people of color, and we know across the board with people of color, men and women, mind you, they are, the way that they learn is through engagement and entertainment. Entertainment is the way that they learn, because that's what keeps their focus and captivates them. And that's how we're able to educate them afterwards, because we have their, their attention. Um, so yeah. So lastly, last slide. Black Girl Health, we always look forward to partnering with agencies who are trying to target people of color and spread health awareness. Again, not just HIV, but any sort of health issues that disproportionately affect people of color. In your community, if this is interesting, you may want to take Pop the Question. You may want to partner with Black Girl Health and the Pop the Question campaign in your area. We would love to work with you guys. So if you're interested in any of our outreach services, again, please contact me. My email is right there, publisher@blackgirlhealth.com. And we would love to kind of strategize and work together. So that is my presentation, folks. I guess, Brian, Edward, do you want me to take questions, or?
I have it from here, Portia. Thank you for a wonderful presentation. We'd now like to open it up for any questions. You can just put your questions into the chat box, and I will collect them from there and read them out loud to our speaker. You can put your question into the chat box. Okay, Portia, we have a question from Molly.
Mm-hmm.
It reads, have you considered moving into the LGBTQ communities of color?
Well, we one thing we want to do, actually, we have a proposal that's out there, and we would love to explore another phase of our Pop the Question campaign, and that is to reach people who, men as well, African American men, and men who have sex with men, because that's an important part of Pop the Question, and men also need to know, their risk, and how to pop the question to their significant other and their partners, and they need to be open with their partners, if they're if it's a male or female, about their sexuality and their entire situation. So we are looking into another phase of Pop the Question, which we're trying to explore, because we do have a proposal that lends to that, on targeting men who have sex with men as well, and including that into our Pop the Question campaign. So hopefully that answers your question.
Thank you, Molly, for that question. We have a question from Barbara. How did you contact the influencers?
So we have a portal. So that's something that's part of our services. So we have a portal of social influencers, people that we work with. We have a membership of health professionals and people that we partner with in Black Girl Health. So they're contracted with us. So we have a network.
We have time for a couple of more questions if anyone wants to put it into the chat box. Portia, we have a question from Ashley. Do you allow other organizations to train community members on the program, or do you prefer Black Girl Health conduct a training like this?
I'm sorry, Edward, can you say that question again?
It's a two-part question. So it reads, do you allow other organizations to train community members on the program, or do you prefer Black Girl Health to conduct a training like this?
So typically we prefer that that you partner with Black Girl Health, and we be involved with any kind of campaign. So you can, obviously, if it's something like you want Pop the Question in your area, so to spread HIV awareness, so then you would be partnering with Black Girl Health. If you if it's just in general a separate campaign that you are doing, and you want them to be trained on how to reach that population, then you would just contract with Black Girl Health, and we will work one-on-one with whatever type of campaign, whatever you're trying to do.
And we can take one more question.
And also, I see, just real quick, Edward, I just see a lot of emails. If you guys can email me, and I'll just forward over the I'll forward over the PowerPoint. That's the easiest. So if you just email me at the email I had on the screen, publisher@blackgirlhealth.com, and I will just automatically forward over that. I will send that that presentation to you, and then you can watch the videos in there. That would be the easiest way.
And we have put your email into the chat box.
Perfect. I'm sorry, there was one more question you wanted to take, Edward.
Yes, I was trying to see if anyone would put anything into the chat box.
Okay.
We'll give it a couple more seconds. If not, thank you again for that wonderful presentation, Portia. It was a pleasure to have you with us.
Thank you. Thank you so much. Thank you.